Hello, and welcome to today's presentation on the start of care. Sign now. You've probably heard about this during your general orientation, but we'll talk about it again today. Your admission paperwork is signed through Sign Now, which is a fast, efficient way to get signed paperwork directly to the office. Paperwork will be emailed to you and the patient. The patient can sign from their phone or computer as you review it with them. A signed copy will be emailed directly to you and the patient. And if the patient is unable to sign electronically, you can use the admission booklet forms and return those copies to the office. Each patient will receive an admission booklet on the patient's guide to home care services. There's no need to read line by line this booklet to the patient, but it is important to review the table of contents with them so they understand what is in it. There's a few key topics in there that every surveyor will ask a patient if they happen to go into that home. And they are, were your patient rights explained to you? Were your frequency, duration, and discipline explained to you? Do you know how to call the office after hours? And do you know who the administrator is and how to contact them? All of that is in the patient handbook, so I would review that with them for sure. Here's some of the patient rights that you should verbally review with them. They have the right to be informed in advance, the disciplines and frequency of care and their financial responsibility. And we'll talk about the form that captures this shortly. They have the right to voice complaints, grievances, and who to contact. So we have to tell them who the administrator is and how to contact he or her, the state hotline number, and your accreditation body. They have the right to be involved in developing the plan of care, to receive all services listed, and to refuse services. To be free from all forms of abuse, neglect, and exploitation, and to have a confidential medical record. Patients also have responsibilities, and those include to provide accurate medical information and changes to include advanced directives, to follow the plan of care, although we already talked about that they have the right to refuse services. So it's a very gray area. If you have a patient that's not following those physician orders, please call the office and we can talk through it. And they also have the responsibility to notify the agency for changes in schedule. Advanced directives includes a living will, a healthcare surrogate designation, anatomical donation, and DNR. If you have a patient that's do not resuscitate, please ensure that they have the yellow copy physician signed order for do not resuscitate. And if not, give us a call so we can help expedite that. The patients will learn about abuse, neglect, and exploitation, and it breaks it out into the types of abuse, physical and emotional, neglect, which oftentimes in home health, we see failure to provide services, and sexual abuse, contact or verbal. Patient safety. Refer to the patient's admission booklet for details on the following safety practices. They will include general home safety, bathroom safety, electrical safety, fall precautions, fire safety, hazardous materials, poisons, medication safety, oxygen safety, and in rare cases with us here at Elite, pediatric safety. There will also be a form in the admission packet that is the assumption of risk waiver that protects the company against liability for accidental exposure to COVID. And remember, screening is still in place. Each patient needs to be screened prior to every visit, and each employee needs to screen themselves daily and report to the office. PPE, masks are still being worn while in the patient's home. Always frequent hand hygiene before, during, and after care, and glove use when touching the patient. The admission consent. Here's where we find the frequency, duration, the amount of dollars the patient has to pay for services on this form. It's a very important form. So here we have an example of a patient that may have orders for 2-week 2. We want to add an additional PRN visit for that, and maybe we only see them 3. So it's really great to range the visits just a little bit. We can't have them too wide, but 3 to 5 visits is very appropriate for this type of patient where we expect to see them 2 weeks 2. And then for the physical therapist, when you're admitting the case, you don't know how many visits that physical therapist is going to need. That physical therapist doesn't know until they go see the patient. So we would simply write eval and treat if it's a case that they're going to receive physical therapy as well. Assignment of benefits is another form that we use here at Elite for billing and to get paid for our services. Remember that with signatures, anytime you're the agency representative, include your title and always the date for the signatures. The patient's acknowledgement, this form has a lot of information that identifies certain information that we've provided the patient. First of all, we have the patient's guide to home care, and this is the table of contents. We have, if there's an unskilled case where a home health aide may be doing medication reminder, we need to have their consent for that, and that's this section here. This is the advanced directives. You're going to click the appropriate box under that section. We have website and social media, and whether they authorize any of the following, make sure and check the appropriate box. Our cancellation of policy is here, and this needs to be initial. Here's an area that's missed a lot, and that's the people that we may be able to share medical information with. Please don't leave that blank. If they don't have anybody, then we would say patient denies or NA in that area. And then here we have our signatures again. The patient-specific emergency evacuation plan. There's a lot of state regulations around the information that's on this form that we need to gather. So it has what their evacuation plan would be, any emergency contacts. Their risk level is here. Most of our patients are a low risk. If you feel that they're a medium or high risk, please call the office because there's more paperwork that we need to do for those patients. And then we have some general information of things we want to know about the patient, and then a section for comments. And here we have our signatures. And you all will receive your mandatory emergency management in service upon hire and annually. Here's our medication profile. You need to document all medications the patient is on. For like medications, for instance, for like medications for a cause, Percocet and Tylenol are both given for pain. We want to know, when would you give Percocet over Tylenol? So this example says that we are going to give it moderate to severe pain for the Percocet and mild pain for the Tylenol. And then always, anytime you write something for PRN, whether it's a medication or a treatment, we need to identify what that PRN means. And we did it here with the pain. I'd like you to take a look at the lower left-hand corner of the screen. These are all high-risk abbreviations that we would like you not to use. And I'll give you a couple of examples. So we do a lot of faxing back and forth. So imagine what a CC or an OD or an OU could look like on a fax, or how about the @ symbol? That can look like zeros, right? And then look at these 3 abbreviations here. Those could all look alike. We could think that's a 0 somewhere in there. And then greater than and less than, some people don't know which one to use and may use the wrong one. So I always say, when in doubt, write it out as far as abbreviations go. Here is the aid care plan. Now, I know that the samples here are blurry, but they're here just for conversation. So the form on the left is an aid care plan. So if we admit a patient that does not require a plan of care or a 485, and that means the patient will not receive any skilled care. And depending on the payer source, we might be able to do this form instead of a 485. You'll be alerted from the office if you need to complete this form. You will see the aid care plan in your admission booklet, and this is to assign tasks to the aide. We also assign those tasks in the EMR, but what if the aide starts care before we finished everything in the EMR and they need to know what to do? So we're going to fill this paper copy out and leave it in the home for the aide, and we're also going to complete it in the EMR and making sure that they match. And that everything we're putting on here sort of matches the assessment that we're doing on the patient as well. And then finally, the site visit verification form. You do clock in and out, and the patient does sign in our electronic medical record. However, we would like also a paper copy of that. So this form is intended for a single patient. You can use it the entire duration that you're seeing them, because for the patients that we typically see for less than 2 weeks, or you can hand it in weekly if you want to. But we need to capture the patient's signature each day, tell sort of what kind of service was performed, and then you signing with your credentials. So documentation and the admission paperwork is very important. And always remember, if you didn't document it, then it didn't happen. Thank you for attending this in-service, and please, if you have any questions, give the office a call.